Welcome back to Weekend Prime. I'm Robinson Okenye. Now, Millennium Development Goal 5 set an ambitious target to improve maternal health and cut maternal deaths by 3/4, reducing the number of women dying for every 100,000 live births. Now, despite years of effort, investment, and advocacy, Kenya's maternal mortality rate remains alarmingly high. Every single day, at least 16 women lose their lives while giving life. Deaths that experts say are largely preventable. In this episode of Health Digest, Gloria Milimu takes a deeper look at the factors undermining progress in the fight against maternal deaths, from policy gaps to the decline in skilled birth attendants, and also examines how these challenges continue to put mothers and newborns at greater risk. Take a look.
With less than 5 years left to meet the 2030 Sustainable Development Goals, Kenya's maternal health continues to face significant challenges. Despite major strides in healthcare, maternal deaths continue to paint a grim picture, with experts warning that the country records 355 deaths for every 100,000 live births, roughly 6,000 preventable deaths each year. Whereas loss of blood or postpartum hemorrhage remains the leading cause of maternal mortality in the country, obstructed labor and eclampsia are also other factors that continue to contribute to this growing number of fatalities. Yet, even as these long-standing threats persist, experts say a new and worrying trend is emerging. An upsurge in home deliveries, many conduct without skilled assistance, is now catching the attention of health professionals. This worrying rise has been linked to the recent health sector reforms, particularly the transition from the free Linda Mama maternity program under NHIF to the new Social Health Insurance Fund SHIF. They warn that the uptake of skilled birth has plummeted from the initial 79% to 69%, a drop that they attribute to policies that disfranchise women from areas where proximity to level 4 facilities is a challenge. Counties like Nairobi have also been hit hard, as skilled birth attendance that was at 100% has reduced to 82%, according to data by the Council of Governors. In Kisumu County, the situation mirrors the national trend. Skilled deliveries have plummeted from 89% in 2022 to just 67%, signaling growing reliance on unsafe home births. The government insists that the new maternity scheme under the Social Health Authority, now branded Linda Jamii, aims to broaden coverage and protect mothers, newborns, and families across the country. Yet, on the ground, challenges persist. From unlawful detentions of mothers unable to settle maternity bills to families struggling to afford sharp premiums, the cracks in the country's maternal health care scheme are becoming increasingly visible. Experts warn that this regression in access threatens to undo years of hard-won progress in safeguarding the lives of women and their newborns. But amid the growing concern, some counties are taking bold steps to reverse the tide. In Nairobi County, for instance, efforts are underway to sensitize communities on the importance of skilled birth attendants. At the same time, hospitals are ramping up strategies to combat postpartum hemorrhage. Among them is Mbagathi Hospital, where at least 800 deliveries take place each month. Here, a renewed focus has been placed on ensuring a steady supply of blood, a resource that can literally mean the difference between life and death for mothers in labor. Dr. Erica Kioma, the hospital superintendent, admits that for years the facility has struggled to maintain adequate blood stocks.
Most of the time we face shortages of blood, but as a facility our consumption is between overall facility consumption is between 500 to 600 units of blood per month, but part of that units, 40% is consumed by our maternity services.
We don't have a screening center. So all the facilities rely on the National Blood Transfusion Unit at KNH. And sometimes when that center runs out of blood, we are forced to source further, for example, the regional center in Embu.
Being a referral facility, availability of blood screening services is said to be a crucial component in ensuring the survival of mothers and their infants.
We are soon becoming a collection center, and soon also we'll be screening our own blood, knowing that blood is a very rare commodity. Being a referral facility, sometimes we receive mothers who might have experienced a PBH in the lower facilities, so that by the time they're arriving here, they might have lost a lot of blood. And what we do as a facility, we attend to these mothers immediately.
Kenya ranks 4th in Africa with the highest maternal mortality rate. But even as counties struggle to prevent these deaths, experts say that there is need for adequate budgetary allocation to the health sector in order to ensure that facilities deliver quality maternal services. Also, they advise that systemic challenges that continue to dog the new health scheme need to be addressed in order to ensure that every mother can access quality and affordable health care without incurring any financial catastrophe. Gloria Milimu, KTN.